I have been a psychiatrist for, I would say, about 14 years. And in our psychiatric training, you go through different subspecialties. So I have worked with adults, with the elderly, and with children and adolescents. My passion is very much working with young people and their families. And in that, I have worked with children and adolescents for many years now. I have worked in inpatient units as well as in outpatient clinics, and I continue to do so in my NHS role as well. So, interestingly, I've always known I want to be a psychiatrist. It's not one of those things that you hear children say, I want to be a psychiatrist, but I kind of did. And I've always been very passionate about working with children and young people because they keep you on your toes. They're very interesting. You're never bored, and there's so much growth that still happens. Very privileged to be a psychiatrist because people really share parts of themselves that they might have not shared with anyone else. So, I'm very grateful to the patients that I've seen, the families that I've come across. We have lots of young people and families coming to see me because actually, as I said, they've just realized, am I autistic? I feel a little bit different. I want to understand a little bit more about myself. And so that's why some of these assessments might happen as well. But ultimately, the vast majority of assessments will happen, as I said, if there are difficulties with your interaction with others or predominantly in terms of accessing school or education. It's not autism that is the problem. It's actually the fact that the world around you might not be adapted to your needs. So actually, we talk a lot about, if you're a flamingo living with a polar bear and the polar bear says, become one of us, the flamingo is going to have a lot of difficulties and vice versa. So again, like the phone analogy that I used earlier, it's just gain a better understanding about yourself and to give others that understanding.